Is it beneficial to diagnose scoliosis early? Unfortunately, scoliosis is not always easy to detect. The signs of scoliosis can be very subtle, especially while it's developing and especially while in smaller sizes. In many cases, only experts trained in the condition and its characteristics can identify the early signs. The milder the scoliosis, the harder it is to detect and the harder it is to diagnose. When we look at scoliosis, we notice every case is unique, but in children, the earliest signs are just postural changes. As we see uneven forces that are distributed throughout the body, we see an overall body asymmetry. We see symmetry of the shoulders tend to be uneven, shoulder blades be uneven, the hips cannot be aligned properly. And again, it may just start off very, very subtle and tend to expand if the curve were to progress. In adults, what we see is that what generally brings on the diagnosis is going to be pain. And this pain is typically low back pain because this is when scoliosis becomes compressive in the adult form. Now, when we try to diagnose scoliosis, we diagnose it through a combination of physical examination and also any type of imaging that's needed. And the first thing that typically involves is something called Adams forward bending test. And this is a bending forward test where the patient bends forwards at the hips and we look at the spine in the position that's parallel to the ground. When they bend forward and they round their upper back or their thoracic spine, we can see trunk asymmetries more easily this way. And typically if there's a thoracic curvature, and when we combine this forward bending test with something called the scoliometer, you can really see any type of tilt. However, Adams forward bending test may not be able to reveal a lumbar curve, and many patients may go undiagnosed. If there's a positive physical examination, meaning uneven shoulders, uneven waist, uneven hips, a positive forward bending test, then typically that warrants further imaging. And the most common image that's taken is something called the scoliosis X-ray. And this X-ray is taken to confirm the rotational component associated with the scoliosis and also to measure something called the Cobb angle. And when we look at a Cobb angle, that's what's helping us determine the size of the scoliosis. Now, there was a time that scoliosis screenings were performed in every elementary school across the United States. However, that has changed. And now the early detection falls on the parents' shoulders, caregivers. It can also be the patients themselves. And scoliosis screenings should be really started early. Now, the problem is that every child goes through puberty at a different age. It's not given that every child is going to go through growth at the exact same time. So since puberty is a variable among children, and it can be anywhere from 10, 11 years of age to 15 or 16, depending on whether it's a male or female. Therefore, when the curve grows, it gets bigger as a result of this growth, can be a very different time frame. So if there's any type of family history, if there's any other type of postural asymmetry, you should be checking kids pre and post growth because that's when it tends to happen. Now, when we look at somebody with scoliosis, we know that scoliosis isn't a genetic condition, meaning they've done studies on identical twins, and they've only found about 60% of identical twins to share scoliosis. But it is familiar, meaning that there is more likely to run in families, but there hasn't been a single gene or genetic combination that accounts for the development of scoliosis. And that's why we call it idiopathic scoliosis. Idiopathic scoliosis, we consider it to be multifactorial, caused by a number of variables that can differ from person to person. However, families share a lot more than just your genes. Having scoliosis in the family is a risk factor, but it doesn't mean that if somebody in your family has scoliosis, you're definitely going to have it. But it does mean if somebody in your family has scoliosis, you should definitely be monitoring it more closely, especially at younger ages and especially during growth spurts. Now, when we detect a scoliosis early, what does this mean? This means that we can also treat a scoliosis early. Now, unfortunately, in traditional treatment approaches, early detection doesn't normally mean early intervention. Very often, nothing is done until the curve gets more severe and they consider surgery. However, in modern conservative approaches, we know that we can treat scoliosis at a smaller size. There's much fewer limitations to what can be achieved. And the sooner we treat a scoliosis means the better results we can get and the less likely it's going to worsen. Because we know scoliosis is a progressive condition. It worsens over time, but also as curves get bigger, they're more likely to get bigger. So if we can treat a curve small and keep it small, then we reduce the risk of it progressing during growth phases. Also, as curves get bigger, they get more rigid and they get much less responsive to conservative treatment. So therefore, treating a smaller curve can always lead to a better result than treating the same person with a bigger curve later. So proactive treatment that's applied in an early diagnosis can be very, very significant to how it changes the course of somebody's life. Even though we know scoliosis is incurable, we know treating it earlier can lead to a much more significant improvement. While a single asymmetry in somebody's body or posture doesn't always guarantee a diagnosis of scoliosis, it definitely warrants further investigation, especially in a child and an adolescent that's pre-puberty or going through puberty. So that's why here at the center, we're really focused on proactive treatment, and we want to start treatment as close to the diagnosis as possible because we know those are the best results that we're going to have for our patients. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.